Welcome to our video series, Conceptual Relationships of Words in the English Language. In this series, we present English vocabulary in a structured and hierarchical manner. Each video showcases a range of terms and their corresponding definitions, presented in an organized sequence from broader concepts to more specific details. The series is divided into playlists, videos, and sections, each delving into distinct aspects of the English language. To get the most out of these videos, here are some of the suggested uses. We will be using WordNet as our primary reference throughout the series. For detailed information about WordNet, please visit the official WordNet website. If you're new to our channel, we recommend starting with our introductory videos. They provide essential context for understanding our approach, purpose, and methodology. For simpler navigation, we presented an outline of the terms and relationships in one of these introductory videos. Remember to show your support by liking, commenting, sharing, and subscribing to our channel. In this episode, we will explore Disorder Part 1. It covers miscellaneous disorders not belonging to mental and nervous disorders. This video is part of the playlist Attribute State. Attribute State playlist is one of two playlists devoted to the conceptual domain attribute. Attributes are linguistic elements that serve as modifiers to provide descriptive information about another word. They convey qualities, characteristics, or properties associated with the entities they modify, enriching the meaning and context of the expression. Section 1. In this section, we will explore degenerative disorder, failure, and related words.
Condition. Condition.
A state at a particular time.
The current status of the arms negotiations.
Physical condition. Physical condition.
The condition or state of the body or bodily functions.
Disorder. Disorder.
A physical condition in which there is a disturbance of normal functioning.
The doctor prescribed some medicine for the disorder.
Degenerative disorder. Degenerative disorder.
Condition leading to progressive loss of function.
Chorea. Chorea.
Any of several degenerative nervous disorders characterized by spasmodic movements of the body and limbs.
Huntington's chorea. Huntington's chorea.
Hereditary disease, develops in adulthood and ends in dementia.
Orthochorea. Orthochorea.
A form of chorea in which spasms occur mainly when the patient is erect.
Sydenham's chorea. Sydenham's chorea.
Chorea occurring chiefly in children and associated with rheumatic fever.
Tarantism. Tarantism.
A nervous disorder characterized by an uncontrollable impulse to dance, popularly attributed to bite of the southern European tarantula or wolf spider.
Demyelination. Demyelination.
Loss of the myelin covering of some nerve fibers, resulting in their impaired function.
Dystrophy. Dystrophy.
Any degenerative disorder resulting from inadequate or faulty nutrition.
Osteodystrophy. Osteodystrophy.
Defective bone development, usually attributable to renal disease or to disturbances in calcium and phosphorus metabolism.
Multiple sclerosis. Multiple sclerosis.
A chronic progressive nervous disorder involving loss of myelin sheath around certain nerve fibers.
Paralysis agitans. Paralysis agitans.
A degenerative disorder of the central nervous system characterized by tremor and impaired muscular coordination.
Failure. Failure.
Loss of ability to function normally.
Kidney failure.
Heart failure. Heart failure.
Inability of the heart to pump enough blood to sustain normal bodily functions.
Congestive heart failure. Congestive heart failure.
Inability to pump enough blood to avoid congestion in the tissues.
Heart attack. Heart attack.
A sudden severe instance of abnormal heart function.
Renal failure. Renal failure.
Inability of the kidneys to excrete wastes and to help maintain the electrolyte balance.
Acute renal failure. Acute renal failure.
Renal failure associated with burns or other trauma or with acute infection or obstruction of the urinary tract.
Chronic renal failure. Chronic renal failure.
Renal failure that can result from a variety of systemic disorders.
Functional disorder. Functional disorder.
Disorder showing symptoms for which no physiological or anatomical cause can be identified.
Phantods. Phantods.
An ill-defined state of irritability and distress.
Hyperactivity. Hyperactivity.
A condition characterized by excessive restlessness in movement.
Organic disorder. Organic disorder.
Disorder caused by a detectable physiological or structural change in an organ. Section 2. In this section, we will explore glandular and some muscular and skeletal disorders.
Glandular disease. Glandular disease.
A disorder of the glands of the body.
Addison's disease. Addison's disease.
A glandular disorder caused by failure of function of the cortex of the adrenal gland, and marked by anemia and prostration with brownish skin.
Adenopathy. Adenopathy.
A glandular disease or enlargement of glandular tissue, especially of the lymph glands.
Aldosteronism. Aldosteronism.
A condition caused by overproduction of aldosterone.
Cushing's disease. Cushing's disease.
A glandular disorder caused by excessive ACTH, resulting in greater than normal functioning of the adrenal gland, characterized by obesity.
Cushing's syndrome. Cushing's syndrome.
A glandular disorder caused by excessive cortisol.
Hyperparathyroidism. Hyperparathyroidism.
Excessive secretion of parathyroid hormone resulting in abnormally high levels of calcium in the blood can affect many systems of the body, especially causing bone resorption and osteoporosis.
Hyperpituitarism. Hyperpituitarism.
Excessive activity of the pituitary gland, especially overactivity of the anterior lobe, which leads to excess secretion of growth hormone.
Hyperthyroidism. Hyperthyroidism.
An overactive thyroid gland, pathologically excessive production of thyroid hormones, or the condition resulting from excessive production of thyroid hormones.
Graves' disease. Graves' disease.
Exophthalmos occurring in association with goiter, hyperthyroidism with protrusion of the eyeballs.
Hypoparathyroidism. Hypoparathyroidism.
Inadequate secretion of parathyroid hormone, resulting in abnormally low levels of calcium in the blood.
Hypothyroidism. Hypothyroidism.
An underactive thyroid gland, a glandular disorder resulting from insufficient production of thyroid hormones.
Cretinism. Cretinism.
Severe hypothyroidism resulting in physical and mental stunting.
Myxedema. Myxedema.
Hypothyroidism marked by dry skin and swellings around lips and nose, as well as mental deterioration.
Abocclusion. Abocclusion.
The condition in which the upper teeth do not touch the lower teeth when biting.
Chylosis. Chylosis.
A disorder of the lips marked by scaling and fissures at the corners of the mouth, caused by a deficiency of riboflavin.
Impaction. Impaction.
A disorder in which a tooth is so crowded in its socket that it cannot erupt normally.
Malocclusion. Malocclusion.
Dentistry, a condition in which the opposing teeth do not mesh normally.
Overbite. Overbite.
Dentistry, malocclusion in which the upper teeth extend abnormally far over the lower teeth.
Dysphagia. Dysphagia.
A disorder in the sense of touch.
Dysosmia. Dysosmia.
A disorder in the sense of smell. Section 3. In this section, we will explore digestive, eating and metabolism disorders.
Achlorhydria. Achlorhydria.
An abnormal deficiency or absence of free hydrochloric acid in the gastric juice, often associated with severe anemias and cancer of the stomach.
Acolia. Acolia.
A condition in which little or no bile is secreted or the flow of bile into the digestive tract is obstructed.
Achalia. Achalia.
Absence of gastric juices, partial or complete.
Celiac disease. Celiac disease.
A disorder in children and adults, inability to tolerate wheat protein, gluten. Symptoms include foul-smelling diarrhea and emaciation, often accompanied by lactose intolerance.
Sprue. Sprue.
A chronic disorder that occurs in tropical and non-tropical forms, and in both children and adults. Nutrients are not absorbed. Symptoms include foul-smelling diarrhea and emaciation.
Dysphagia. Dysphagia.
Condition in which swallowing is difficult or painful.
Eating disorder. Eating disorder.
A disorder of the normal eating routine.
Anorexia. Anorexia.
A prolonged disorder of eating due to loss of appetite.
Anorexia nervosa. Anorexia nervosa.
Psychiatry, a psychological disorder characterized by somatic delusions that you are too fat despite being emaciated.
Bulimorexia. Bulimorexia.
A disorder of eating in which the person alternates between strong craving for food and aversion to food, characterized by excessive eating, followed by periods of fasting or self-induced vomiting.
Bulimia. Bulimia.
A disorder of eating seen among young women who go on eating binges, and then feel guilt and depression and self-condemnation.
Pica. Pica.
An eating disorder, frequent in children, in which non-nutritional objects are eaten persistently.
Geophagy. Geophagy.
Eating earth, clay, chalk, occurs in some primitive tribes, sometimes in cases of nutritional deficiency or obsessive behavior.
Metabolic disorder. Metabolic disorder.
A disorder or defect of metabolism.
Alkaptonuria. Alkaptonuria.
A rare recessive metabolic anomaly marked by achronosis and the presence of alkapton in the urine.
Hyperlipoproteinemia. Hyperlipoproteinemia.
Any of various disorders of lipoprotein and cholesterol metabolism that result in high levels of lipoprotein and cholesterol in the circulating blood.
Hyperbeta-lipoproteinemia. Hyperbeta-lipoproteinemia.
A genetic disorder characterized by high levels of beta-lipoproteins and cholesterol can lead to atherosclerosis at an early age.
Hypolipoproteinemia. Hypolipoproteinemia.
Any of various disorders of lipoprotein and cholesterol metabolism that result in low levels of lipoprotein and cholesterol in the circulating blood.
Hypobeta-lipoproteinemia. Hypobeta-lipoproteinemia.
A hereditary disorder characterized by low levels of beta-lipoproteins and lipids and cholesterol.
Abeta-lipoproteinemia. Abeta-lipoproteinemia.
A rare inherited disorder of fat metabolism, characterized by severe deficiency of beta-lipoproteins and abnormal red blood cells, acanthocytes, and abnormally low cholesterol levels.
Inborn error of metabolism. Inborn error of metabolism.
Any of a number of diseases in which an inherited defect, usually a missing or inadequate enzyme, results in an abnormality of metabolism.
Galactosemia. Galactosemia.
A genetic disease, autosomal recessive, in which an enzyme needed to metabolize galactose is deficient or absent, typically develops shortly after birth.
Lysonemia. Lysonemia.
An inborn error of metabolism in which the lack of certain enzymes leads to an inability to metabolize the amino acid lysine, characterized by muscular weakness and mental retardation.
Niemann-Pick disease. Niemann-Pick disease.
A disorder of lipid metabolism that is inherited as an autosomal recessive trait.
Phenylketonuria. Phenylketonuria.
A genetic disorder of metabolism, lack of the enzyme needed to turn phenylalanine into tyrosine results in an accumulation of phenylalanine in the body fluids which causes various degrees of mental deficiency.
Lipidosis. Lipidosis.
A disorder of lipid metabolism, abnormal levels of certain fats accumulate in the body.
Abetalipoproteinemia. Abetalipoproteinemia.
A rare inherited disorder of fat metabolism, characterized by severe deficiency of beta-lipoproteins and abnormal red blood cells, acanthocytes, and abnormally low cholesterol levels.
Gaucher's disease. Gaucher's disease.
A rare chronic disorder of lipid metabolism of genetic origin.
Niemann-Pick disease. Niemann-Pick disease.
A disorder of lipid metabolism that is inherited as an autosomal recessive trait.
Tay-Sachs disease. Tay-Sachs disease.
A hereditary disorder of lipid metabolism occurring most frequently in individuals of Jewish descent in Eastern Europe. Accumulation of lipids in nervous tissue results in death in early childhood.
Lysine intolerance. Lysine intolerance.
A disorder in which a lack of certain enzymes makes it impossible to digest the amino acid lysine. Section 4. In this section, we will explore heart disease.
Cardiovascular disease. Cardiovascular disease.
A disease of the heart or blood vessels.
Heart disease. Heart disease.
A disease of the heart.
Angina pectoris. Angina pectoris.
A heart condition marked by paroxysms of chest pain due to reduced oxygen to the heart.
Cardiac arrhythmia. Cardiac arrhythmia.
An abnormal rate of muscle contractions in the heart.
Atrial fibrillation. Atrial fibrillation.
Fibrillation of the muscles of the atria of the heart.
Bradycardia. Bradycardia.
Abnormally slow heartbeat.
Flutter. Flutter.
Abnormally rapid beating of the auricles of the heart, especially in irregular rhythm, can result in heart block.
Gallop rhythm. Gallop rhythm.
Cardiac rhythm characterized by the presence of an extra sound can indicate a heart abnormality.
Heart block. Heart block.
Recurrent sudden attacks of unconsciousness caused by impaired conduction of the impulse that regulates the heartbeat.
Premature ventricular contraction. Premature ventricular contraction.
Irregularity of cardiac rhythm. Recurrent occurrences can be a precursor of ventricular fibrillation.
Tachycardia. Tachycardia.
Abnormally rapid heartbeat, over 100 beats per minute.
Ventricular fibrillation. Ventricular fibrillation.
Fibrillation of heart muscles resulting in interference with rhythmic contractions of the ventricles, and possibly leading to cardiac arrest.
Cardiomyopathy. Cardiomyopathy.
A disorder, usually of unknown origin, of the heart muscle, myocardium.
Hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy.
A disorder in which the heart muscle is so strong that it does not relax enough to fill the heart with blood, and so has reduced pumping ability.
Coronary heart disease. Coronary heart disease.
The heart disease due to an abnormality of the arteries that supply blood and oxygen to the heart.
Coronary occlusion. Coronary occlusion.
Occlusion of a coronary artery caused either by progressive atherosclerosis or by a blood clot.
Coronary thrombosis. Coronary thrombosis.
Obstruction of blood flow in a coronary artery by a blood clot, thrombus.
Heart failure. Heart failure.
Inability of the heart to pump enough blood to sustain normal bodily functions.
Congestive heart failure. Congestive heart failure.
Inability to pump enough blood to avoid congestion in the tissues.
Heart attack. Heart attack.
A sudden severe instance of abnormal heart function.
Rheumatic heart disease. Rheumatic heart disease.
Heart disease caused by recurrent episodes of rheumatic fever, characterized by changes in the myocardium or scarring of the heart valves that reduce the power of the heart to pump blood.
Valvular heart disease. Valvular heart disease.
Heart disease caused by stenosis of the cardiac valves and obstructed blood flow or caused by degeneration and blood regurgitation.
Aortic stenosis. Aortic stenosis.
Abnormal narrowing of the aortic valve.
Mitral stenosis. Mitral stenosis.
Obstruction or narrowing of the mitral valve, as by scarring from rheumatic fever.
Mitral valve prolapse. Mitral valve prolapse.
Cardiopathy resulting from the mitral valve not regulating the flow of blood between the left atrium and left ventricle of the heart. Section 5. In this section, we will explore cardiovascular disease and related words.
Aneurysm. Aneurysm.
A cardiovascular disease characterized by a sac-like widening of an artery resulting from weakening of the artery wall.
Aortic aneurysm. Aortic aneurysm.
An aneurysm of the aorta.
Abdominal aortic aneurysm. Abdominal aortic aneurysm.
An aneurysm of the abdominal aorta associated with old age and hypertension.
Cerebral aneurysm. Cerebral aneurysm.
An aneurysm of the carotid artery.
Intracranial aneurysm. Intracranial aneurysm.
An aneurysm of a cranial artery.
Ventricular aneurysm. Ventricular aneurysm.
The localized dilation or protrusion on the wall of the left ventricle of the heart, occurring after a myocardial infarction.
Circulatory failure. Circulatory failure.
Failure of the cardiovascular system to supply adequate amounts of blood to body tissues.
High blood pressure. High blood pressure.
A common disorder in which blood pressure remains abnormally high, a reading of 140/90 millimeters Hg or greater.
Essential hypertension. Essential hypertension.
Persistent and pathological high blood pressure for which no specific cause can be found.
Malignant hypertension. Malignant hypertension.
Severe hypertension that runs a rapid course and damages the inner linings of the blood vessels and the heart and spleen and kidneys and brain.
Malignant hypertension is the most lethal form of hypertension.
Portal hypertension. Portal hypertension.
Increase in blood pressure in the veins of the portal system, caused by obstruction in the liver, often associated with alcoholic cirrhosis, causing enlargement of the spleen and collateral veins.
Secondary hypertension. Secondary hypertension.
Hypertension that is secondary to another disease.
White coat hypertension. White coat hypertension.
Temporary rise in blood pressure in the doctor's office.
Hypotension. Hypotension.
Abnormally low blood pressure.
Orthostatic hypotension. Orthostatic hypotension.
Low blood pressure occurring in some people when they stand up.
Choking. Choking.
A condition caused by blocking the airways to the lungs, as with food or swelling of the larynx.
Strangulation. Strangulation.
The condition of having respiration stopped by compression of the air passage. Section 6. In this section, we will explore some circulatory, excretion, immune and reproductive disorder.
Hydrocele. Hydrocele.
Disorder in which serous fluid accumulates in a body sac, especially in the scrotum.
Bladder disorder. Bladder disorder.
A disorder of the urinary bladder.
Flaccid bladder. Flaccid bladder.
A urinary bladder disorder resulting from interruption of the reflex arc normally associated with voiding urine, absence of bladder sensation and overfilling of the bladder, and inability to urinate voluntarily.
Neurogenic bladder. Neurogenic bladder.
A urinary bladder disorder caused by a lesion in the nervous system.
Spastic bladder. Spastic bladder.
A urinary bladder disorder resulting from spinal cord lesion or multiple sclerosis or trauma, absence of bladder sensation and incontinence, and interrupted voiding of urine.
Dysuria. Dysuria.
Painful or difficult urination.
Impaction. Impaction.
A disorder in which feces are impacted in the lower colon.
Immunological disorder. Immunological disorder.
A disorder of the immune system.
Anergy. Anergy.
Reduction or lack of an immune response to a specific antigen.
Immunodeficiency. Immunodeficiency.
Immunological disorder in which some part of the body's immune system is inadequate and resistance to infectious diseases is reduced.
Agamoglobulemia. Agamoglobulemia.
A rare immunological disorder characterized by the virtual absence of gamma globulin in the blood and consequent susceptibility to infection.
AIDS. AIDS.
A serious, often fatal, disease of the immune system transmitted through blood products, especially by sexual contact or contaminated needles.
Hypogammaglobulemia. Hypogammaglobulemia.
An abnormally low concentration of gamma globulin in the blood and increased risk of infection.
Severe combined immunodeficiency. Severe combined immunodeficiency.
A congenital disease affecting T cells that can result from a mutation in any one of several different genes. Children with it are susceptible to infectious disease. If untreated, it is lethal within the first year or two of life.
ADA-SID. ADA-SID.
SID resulting from mutation of a gene that codes for adenosine deaminase.
X-linked SID. X-linked SID.
SID in male children resulting from mutation of a gene that codes for a protein on the surface of T cells that allows them to develop a growth factor receptor.
Immunosuppression. Immunosuppression.
Lowering the body's normal immune response to invasion by foreign substances can be deliberate, as in lowering the immune response to prevent rejection of a transplanted organ, or incidental, as a side effect of radiotherapy or chemotherapy for cancer.
Abruptio placentae. Abruptio placentae.
A disorder of pregnancy in which the placenta prematurely separates from the wall of the uterus.
Colpoxerosis. Colpoxerosis.
A condition in which the vagina is unusually dry.
Hematocolpometra. Hematocolpometra.
Accumulation of blood in the vagina and uterus.
Hematocolpo. Hematocolpo.
Accumulation of menstrual blood in the vagina, usually due to an imperforate hymen.
Idiopathic disease. Idiopathic disease.
Any disease arising from internal dysfunctions of unknown cause. Section 7. In this section, we will explore anxiety and mental disorders.
Ailment. Ailment.
An often persistent bodily disorder or disease, a cause for complaining.
Motion sickness. Motion sickness.
The state of being dizzy or nauseated because of the motions that occur while traveling in or on a moving vehicle.
Air sickness. Air sickness.
Motion sickness experienced while traveling by air, especially during turbulence.
Car sickness. Car sickness.
Motion sickness experienced while traveling in a car.
Seasickness. Seasickness.
Motion sickness experienced while traveling on water.
Pip. Pip.
A minor nonspecific ailment.
Sleep disorder. Sleep disorder.
A disturbance of the normal sleep pattern.
Hypersomnia. Hypersomnia.
An inability to stay awake.
Catalepsy. Catalepsy.
A trance-like state with loss of voluntary motion and failure to react to stimuli.
Narcolepsy. Narcolepsy.
A sleep disorder characterized by sudden and uncontrollable episodes of deep sleep.
He believes that narcolepsy is attributable to an inability to suppress REM sleep during waking.
Insomnia. Insomnia.
An inability to sleep, chronic sleeplessness.
Sleep apnea. Sleep apnea.
Apnea that occurs during sleep.
Sudden infant death syndrome. Sudden infant death syndrome.
Sudden and unexpected death of an apparently healthy infant during sleep.
Sleep terror disorder. Sleep terror disorder.
A disorder of sleep characterized by a dream of terrifying dimensions far worse than a typical nightmare. They occur during NREM sleep.
Acute brain disorder. Acute brain disorder.
Any disorder, as sudden confusion or disorientation, in an otherwise normal person that is due to reversible, temporary, impairment of brain tissues, as by head injuries or drugs or infection.
Learning disorder. Learning disorder.
A disorder found in children of normal intelligence who have difficulties in learning specific skills.
Dyscalculia. Dyscalculia.
Impaired ability to learn grade-appropriate mathematics.
Dysgraphia. Dysgraphia.
Impaired ability to learn to write.
Dyslexia. Dyslexia.
Impaired ability to learn to read.
Speech disorder. Speech disorder.
A disorder of oral speech.
Anarthria. Anarthria.
Partial or total loss of articulate speech resulting from lesions of the central nervous system.
Aphonia. Aphonia.
A disorder of the vocal organs that results in the loss of voice.
Cataphasia. Cataphasia.
A speech disorder in which the same word is repeated several times in succession.
Dysarthria. Dysarthria.
Impaired articulatory ability resulting from defects in the peripheral motor nerves or in the speech musculature.
Dyslogia. Dyslogia.
Impaired ability to express ideas verbally, usually resulting from difficulties of reasoning, as enfeeblement or certain psychoses.
Dysphonia. Dysphonia.
Speech disorder attributable to a disorder of phonation.
Laulation. Laulation.
Defective articulation of the L phoneme or the phoneme R is pronounced as L.
Lambdacism. Lambdacism.
Speech defect involving excessive use or unusual pronunciation of the phoneme L.
Lisp. Lisp.
A speech defect that involves pronouncing S like voiceless TH and Z like voice TH.
Stammer. Stammer.
A speech disorder involving hesitations and involuntary repetitions of certain sounds. End of episode. Thank you for watching. If you enjoyed this video, don't forget to like, comment, share, and subscribe to our channel for more engaging content. In the next episode, we will present Attribution.